senior music therapy major here at SAN. So thank you, Dr. Varela, for letting me come. I'm just going to talk about music therapy and how it can help patients with schizophrenia. So you've already learned that schizophrenia is, oh, sorry, I forgot to record you. Schizophrenia is a mental illness that is caused by genes, possibly, or the environment, or can be caused by brain structure and chemistry. They're not really sure. The magical they are not really sure what the cause is. And it can occur at any time in life, usually in adolescence or early adulthood. Rarely it can be seen in children. And it's just very severe. And there is a professor at Texas Women's University. Her name is Dr. Nancy Hadsell, and she's studied adult psychiatrics since about 1976. And she wrote an article basically stating that she feels, as she has worked with schizophrenic patients, she feels that perhaps there are abnormal amounts of adrenaline in the brain, along with traumatic events in childhood and early childhood trauma and a breakdown in personal relationships. And she feels that, from her experience, that those possibly are the things that come together to bring about schizophrenia. As you know, each patient may have one or more of the following types of symptoms. They'll have positive symptoms, which means they'll have delusions, hallucinations, bizarre behaviors, disorganized speech sometimes, and movement disorders, as in the catatonic type, where they either are holding in one position, or maybe they may have erratic movements that are all over the place, and they're not able to control those. They may have negative symptoms, such as a lack of interest in their favorite activities, which kind of can mimic depression, and a lot of times depression can go along with schizophrenia. They may have a lack of caring about personal hygiene, or a lack of being able to take care of themselves. I know of somebody who had a child under 10 years old that should have been able to brush her teeth. She had severe schizophrenia, and she just didn't brush her teeth. She could do a lot of other things, but it was about more than just not wanting to. She just didn't have the, I guess, discipline to hold the toothbrush and do it, so her dad had to do it for her every day. So things like that. Also, there's a decreased emotional expression. A lot of times, people with schizophrenia will have what we call a flat affect. They just may have a blank stare, and they just don't show emotion. It does not mean that they're not feeling it, but they can't process how to show that. It's more of almost like a social thing. Also, cognitive problems. Dr. Varela mentioned how sometimes it seems like they have a low intellectual level, and they may be very smart, but there's a disconnect in their cognitive processing. So just engaging in conversations, simple conversations back and forth, may be very difficult for someone with schizophrenia. For instance, I was researching some interviews online on YouTube, and just these different people were being interviewed, and you would ask them a simple yes or no question, and they could not answer that question. They would just go way off onto something else, and it was very extreme, and you had to continuously redirect them back to that question just to get a simple yes or no. They have problems with memory, trouble paying attention, focus, things like that. And I heard one person on an interview say that it was like there were hallucinations and delusions and all these things just going as a whirlwind in their mind. So it's very hard, if you can imagine, to focus and pay attention on something like that when you've got all these other things going on, and it's very real to them. It's very scary to them. So obviously this affects their life in many ways, activities of daily living. It's kind of hard to clean your house if you're constantly seeing things move that aren't really moving. Or you're watching TV and all of a sudden the person on TV seems to be talking directly to you and saying things to you that are negative. It's just very hard to get anything done when you've got those constant distractions inside your mind. And it's very difficult for people with schizophrenia to maintain social relationships because obviously, especially with paranoia, if they are constantly worried that somebody's out to get them, they're going to withdraw. It's almost more of a withdrawing inside themselves than it is. Sometimes people think schizophrenic people are violent, they lash out at everybody else, but it's this retreat inside their head that's what makes it so scary for them and what makes them seem so weird and antisocial to other people. Obviously, this leads to a difficulty in holding down jobs. Sometimes, even if a person with schizophrenia is doing really well and they're on medication and they're on treatment, there may be types of jobs where if their employer finds out they're schizophrenic, they'll let them go, and they won't state that it's because of that, because they could, be cited for discrimination. But a lot of times, it's just that stigma will cause them to lose their jobs, which can lead to the homelessness and things like that. But also, if they're not doing well, obviously they're not going to be able to function and hold down a job. We did discuss the treatments available. There is no cure, unfortunately, but medication can be one way to manage symptoms, and they're still working on getting that, medication perfected, but it's getting better over the years. A lot of things like patient and family education are really important, because family members may not understand what's going on, and they may need some type of family and group therapy to help everybody understand how to cope, with this person, and for this person to cope with their own mind. Individual, group, and family therapy. Hospitalization is also often required. Sometimes people have episodes and they'll have setbacks due to things like stopping their medication, or just, whatever schizophrenic symptoms may get worse and get better, so they'll have to go to hospitalization. We talked about structure. Sometimes they just do better in a hospital, which is kind of unfortunate sometimes. So that's one way to manage the symptoms. But it can be a good thing, because in a hospital they can get that support that they need. So a final treatment, well, not a final treatment, but another option is music therapy. That can be a good way to help somebody to live a more normal life, have a better quality of life, especially if other treatments maybe aren't working, or at least to combine with other treatments. So I don't know if any of you know what music therapy is, but we have our own little music therapy group sitting over here, so maybe they've educated you a little bit. The American Music Therapy Association states music therapy as the clinical and evidence-based use of music to accomplish individual goals within a therapeutic relationship by a credentialed professional who has completed an approved music therapy program. So that's the definition officially. So what does that mean? I put it in a little bit easier terms maybe to understand. I referred to Dr. Nancy Hadsell a few minutes ago, and she, and working with schizophrenic patients, her definition of music therapy as it applies to them is that it is defined as the use of music in a therapeutic situation for the purpose of changing human behavior, so that the individual that's affected will be more able to function as a member of society. So it's not about the music itself. It's about using the music as a backdrop for bringing structure and bringing stimulation and motivation and possibly a reward for individuals who need to meet certain physical and emotional, cognitive, and social goals. So music therapy can be used in a wide range of populations. So today, we're going to talk about how can music therapy be used with people who have schizophrenia. Obviously, the biggest goal for music therapy would be to help them cope with their symptoms of the illness, and that will affect their lives in other areas. So for specific goals, one of the biggest things that we want to do is reality orientation, reality awareness. Because one of the biggest problems with people that have schizophrenia is they have a hard time processing reality. Their reality is different from everyone else's. And sometimes they're trying to cope with these two realities going on at the same time, the one that's in the world and the one that's in their mind. So as music therapists, we have to be creative and come up with ways to help them focus on the here and now, and to help them, we can use music as a way to help them do activities, and we can call on them and have them lead activities. We can use music as a way to have them communicate with us back and forth. Maybe I'll play an instrument and I'll have them play an instrument, and we'll do like a musical conversation. Also, we want to draw them away from hallucinations and delusions. And sometimes when people are schizophrenic, they find that if they're occupied and their mind is stimulated, they can be drawn away from those hallucinations. It's when kind of they're left by themselves and left in the quiet that it all starts coming flooding back. And so music can be a great way to occupy their mind for maybe 30 minutes or an hour and just get them back into focusing on something. And that tends to help push those hallucinations away. Music can be used as a way to open up communication between people, and like like I said, you can do like a musical conversation back and forth. You could do a group activity, whether it's group drumming or group guitar lessons, and that way musicians have a chance to kind of be in a social setting. They don't have to be musicians, sorry, the patients. And that's another thing. You don't have to be musical to be a music therapy patient. I, as a music therapist, would have to be, musical, obviously, but my job is to try to adapt to you wherever you are musically and make it fun. And I can come in with instruments that maybe are easier to play or that don't require you to know like your chords and your scales and all of that. But anyway, so you could put them in a group setting and then like have guitar lessons. And it's not about learning the guitar, but as I'm teaching them different things on the guitar, maybe they'll start having fun and they'll start socializing with each other and learning social skills and things like that. Also, music is a great way to help people identify and express their emotions. We talked about how the flat affect and the emotional lack of expression that they may have, and it's not because they're not feeling, but they may not be able to even identify what they're feeling. And sometimes we'll use improvisation, and we'll have a certain type of instrument, like maybe a xylophone, where they can just hit it with the mallet and play it, and I might play the piano or something in the background, just kind of accompany them, but I might give them the freedom to express themselves. And they may start out slow and then get faster, and it just sometimes might be a way for them to release some of that expression that they've been holding inside, and then we'll talk about it afterwards, and I'll say, okay, how did that make you feel? What were you trying to say when you were doing that? And sometimes people might say, I didn't even realize that I'm so anxious right now, I have a lot of anxiety, or I'm happy, or I'm angry. And that can get to the bottom of maybe some of their problems that they're having. So it really helps for them to express that. Also, we'll use music relaxation to help with stress and anxiety. Sometimes we'll use guided imagery. We'll play an instrument. We'll have the patient close their eyes and try to help them imagine a safe place or something like that. And we'll do breathing exercises. And a lot of times rhythm affects your breathing and your heart rate. And if you can get that to slow down, that can really reduce anxiety. We can also use music to help control aggressive behaviors and destructive impulses. Sometimes if you have a person with schizophrenia that's just really lashing out, you don't want to reward that behavior, but if you can maybe redirect it and allow them, like for instance, to bang on the xylophone or something like that to get some of that out, then at least they have an outlet for it so that they don't have to take it out on another person or on themselves. So basically for mood management, that would be another thing that we would do. So now we're going to go to music therapy research. We've discussed some of the ways that music therapy can help, some of the goals, and just a few research studies. These are fairly not terribly recent, but it does show that they've been studying this for a while. There was someone named Recker in 1991 who did a study, and they found that some of the positive effects of music therapy on schizophrenic patients were relaxation, reduced anxiety, easier eye contact. That's another thing that we were talking about with the eyes a while ago, and sometimes they can use instruments to help them focus on different things with their eyes, and improved opportunities for emotional expression. And then another research study by Cassidy in 1976 measured some changes in peer acceptance, so being accepted by your peers, group cohesiveness, like especially with the group drumming and the group guitar lessons, just being able to do something as a group is really hard for people with schizophrenia. And then this study measured social relationships, and it found that group guitar lessons were one solution for developing skills in interpersonal relationships. Another study by Che in 1997 talks about how one of the main symptoms of schizophrenia is the inability to focus consistently on relevant stimuli and the inability to filter out irrelevant stimuli. So like they have a hard time with distractions if they're trying to focus on something. And that's where music can come in and be really good. A music therapist could develop an activity where the client had to concentrate on certain instrumental noises while ignoring others. And so it's just kind of a skill that they're going to have to learn. This is kind of a funny example, but I don't know if any of you have seen the movie Man of Steel. But when Superman, Clark Kent, was a little boy, he had these superpowers, and he would see people with his X-ray vision, and it was so powerful, it scared him. He didn't know what to do, and his mom had to talk to him about, you have to focus, and you have to try to look past that. You have to try to look at people the way they are, and not let that scare you. And I don't know, I just think that that's a really neat example, because he grew up just practicing that until he got better at it. And so that's kind of the way that it can be with the focus of attention. I don't know if that makes sense, but another study done by Burleson in 1989, the results showed that music reduced off-task responses that interfered with task performance and therefore increased task accuracy. So again, kind of using music as a backdrop when they gave these patients certain tasks to do, they found that it made the patients able to perform those tasks better and focus better. Just a couple more research articles. One by Smith in 1998 said that switching attention, or a switching attention deficit, was the prominent attention deficit in schizophrenia. In this example, or in this research study, they had a music therapist that used an activity where they would have the clients switch attention from one task to another, and they would use flashlights in different stations set up around the room to direct different musical activities. And so maybe they'd have to focus on one musical activity, and then they would point with a flashlight to another one. And this sounds really low level, but it's really hard for these people to do. And so that was another study that they did. The study by Tang in 1994 it showed that music therapy, significantly diminished patients' negative symptoms. It increased their ability to converse with others, and it therefore reducing their social isolation and increasing their interest in external events. So it had a lot of positive results from this study. And then a final study by Wolfgram in 1978, it found that music therapy was a non-threatening environment. That's another thing about music. It's not like you're sitting on a couch with a psychiatrist and you're forced to talk about your problems or something like that. It's a non-threatening environment. It's fun for most people. There are some people that hate music, and for them, they may not be a good candidate. But for a lot of people, music is a very non-threatening environment. And this study allowed the patient to participate in activities that decreased shame and isolation, social isolation, and it allowed for them to gradually reintegrate into their communities. So the references for all of these studies are on the backs of your handouts if you want to look them up later. So now I'm going to talk about just a couple of music therapy, what we call intervention techniques. And an intervention basically just means an activity and a way of helping the client meet goals. My personal feeling is that the most important technique in music therapy is the ISO principle, and that is meeting a patient where they are in the moment. And that is just huge to me, because especially if you're dealing with mood and expression, if a patient's depressed, you can't just go in their room playing happy song and be like, hey, feel better, because they're just going to be really mad at you, and they might throw something at you, and they might never want to see you again. And that would just make me really angry. So as a therapist, your goal is to meet that person where they are. And a lot of times with mood management, one of the things that we will do is we'll talk to the patient, find out where they are. If they don't want to talk and they're just sitting there staring, we might just start playing something. And especially it helps if you have a history of knowing that patient's favorite music. Maybe you'll play a song that they like. That doesn't require them to do anything. All they have to do is listen. And you might play a slow, sad song or song with depressing lyrics if that's where they are. But either in that one session or throughout several sessions, you can start picking up the beat, switching the lyrics to happier lyrics, changing the music, changing the instruments to reflect a happier mood. And it's kind of like classical conditioning. It'll start to bring the mind and body to a different place emotionally. So that's my favorite thing about music therapy is the ISO principle. It's very important. And it's not just with mood, it's also with the body. We have this thing called rhythmic auditory stimulation. If somebody has trouble with their gait, with their walking, and they're maybe have cerebral palsy, or even with schizophrenia of their motor movements, if their walking is a little bit off, we will use rhythm, and we will time it so that we match the rhythm to where they already are when they're walking. And we will gradually change the rhythm up or down. And as we do that, their brain, it's not even something they're thinking about, their brain will entrain to that movement and it will start matching. But we have to start where the patient is. It's just like if you put a pendulum, and you put another one next to it, and they will start eventually going the same way, and it's called entrainment. And that's basically what the ISO principle is, and so that's what you want to incorporate into all your music therapy activities. So now I'd like to call a volunteer up, preferably, and anybody, I mean, it doesn't have to be Drew. Does anybody else that's not a music therapy major want to be a guinea pig?
Just pick somebody.
Okay.
When they don't talk, you just pick somebody.
Okay. I do actually need 2 people, so Drew, you can be up here if you want. Can you come?
Whoever's not making eye contact, that's who you pick.
Oh, she was making eye contact. That's okay. Drew wasn't just looking down. So I'm just going to demonstrate just a couple of techniques that we will possibly use. So this is going to be, you're going to be a catatonic type schizophrenic, and you are as well, but you're just going to have 2 different types of symptoms. Okay, so let's see. I'm going to start with, I like to work with children, and even though schizophrenia in children is rare, I have a lollipop drum, so I'm going to use it. Let's start with you. Okay, so there's this thing, yes? Sure.
The color on the lollipop drum, does that help them at all with the colors?
Color stimulation is awesome. You can always use, that's why a lot of music therapy toys that we buy are very visual and very colorful, because the brain takes instructions from the eyes and the ears. And a lot of times we'll have toys and instruments that will light up. So yeah, color stimulation is great. And I've cheated and put some lyrics on the back of the drum, mostly to show you that that's something that you can do also, as if you're in a last minute.
Have you just tried anything like a target?
No.
It has a lot of colors, but also to try to keep up with songs.
Is it a drum?
Well, it's like a
Video
video
game.
game.
That's rock band, yeah, you can play.
But also it has colors to go with the buttons plus.
That's very cool. And that's another thing we could probably use in music therapy. See, that's actually a great example of what we'd use for a patient who is not musical and doesn't have a clue how to play the guitar. We would hang on with those.
I'm not entirely too sure how.
Right.
People.
Yeah. So I don't know, but that's a great idea. It's a good idea. So you're going to be, yes. Oh, sorry.
I just wanted to add that that's like a teaching technique for teaching guitar, color coding. Friends.
Oh, because a lot of times our brains associate with colors with. Awesome. Any other questions? I'm so glad you'll have questions. So you're going to be a 7 to 8 year old. Let's just make you a 7-year-old. Is that okay? With schizophrenia, and you have catatonic type, and you have what's called forced grasp, which is where you hold out something and they automatically grasp it. And a lot of times you do want to decrease the grasping behavior, but I also feel like, again, you should meet the patient where they are. So if they're grasping something, why not work with it? Why not give them an instrument and let them hold it and let them have some kind of stimulation? So I'm going to give you this little mallet. You really took it from me. Good job. Okay, this is a lollipop drum. Now, sometimes if they're in the catatonic state, they may not talk or they may not. Oh dear, so this is what we're going to do. Can you hit the drum for me? And if she's having trouble, I'll very good. That's wonderful. And if she's having trouble, I would help her, like that. But obviously, she's not having any trouble. That's wonderful. So we're going to sing a song. You ready to sing a song? Sure. Okay, you keep hitting the drum, okay? On the good ship, lollipop, it's sweet, to the candy shop, where bonbons play, on the sunny beach, peppermint bay. That's perfect. That's great. And so what we're doing is, that's awesome. Now just don't lick it. It's not real. Okay? Just so you know. So that's very good. You can stop now. So what we're doing is we're getting visual stimulation, auditory stimulation, and she's starting to hear that, and eventually her brain is going to be like, maybe I should start reacting and being a little more, and it may not all happen at the first session, but it's a good way to engage her. Oh, you want to turn around and hit it with the side of the stick? That's great. That's great. And so my biggest thing, especially if she was a child, would just be to make sure she didn't try to put this in her mouth and choke on it, that kind of thing.
Or decide that your forehead is a drum.
Or to use my forehead as a drum. That would definitely not be good. I should wear a helmet next time. Now, let's do one other activity with you. This time you don't have forced grasp. Just strike a pose, any pose, and it's called waxy flexibility. And whatever I move you in, you just stay there. Okay? Strike a pose. And I will not laugh at you. I shouldn't have done that. Okay. Now, another thing about people in a catatonic state is they may, sorry, I'm trying to get the video so I can get recorded. They may not show any emotion, and that's what you're going to do during this time. But they may actually feel a great deal of anxiety inside. They just can't express it.
I'm trying to get out of the way of the
Their
camera.
brain is not, their central nervous system is like on pause. So it's like they're unable to move. So what you would do is you talk to them, and you'd be like, I know that you're in a state right now where you can't move, but it's okay. We're just going to play a little musical game, and these are jingle bells. And can I roll up your sleeve just a little bit? These I got at Cracker Barrel. Cracker Barrel is awesome. They have all kinds of fun stuff. These are also good for people who don't have good use of their fingers and can't hold things. So what I would do is, I'm just going to put these little jingle bells, I can't talk, jingle bells on your wrist, and we're just going to clap, okay? We're just going to make some music. And it's Christmas time right now, just so you know. Okay, ready? Jingle bells, jingle all the way. And we would just play around. And it doesn't have to be a Christmas song, but I mean, I figured it worked. And we would just keep doing that. And then maybe we would do it up high, and maybe we would do it down low. And maybe I would clap on her hand like this. And I'm just basically getting her body to respond, getting her body to move, getting her brain to go, you know what, I should be moving now. And it's just encouraging the brain is what it's doing to reset itself and to get out of the pause. One more for you, and then I'll come to you. Okay, this is a bell. It's a hand bell. It's super fun. Once again, you're going to have the forced grasp. Actually, it might work with the waxy flexibility if I can just place it, if it'll stay there. And then I would just, let me put it in the other arm so that I can, there we go. And then we would just do this. Twinkle, twinkle, little star. Kind of loud, maybe, I don't know. But that's going to stimulate your brain a little bit, too. So those are just some ideas that I came up with. So thank you so much for being an awesome client. And now, Drew. This is for an adult. Pretend this is not a child-looking drum. She got to be a child during the whole time. Now, you come over here, scoot over just a little bit so I can get this from. There we go. Okay, now you can strike a pose. You have the waxy flexibility. That's an awesome pose. Okay, hi Drew. I know you're in a state right now where you can't move, but we're just going to do some music, okay? And sometimes you can have the forced grasp, or I can make him. Okay, so I'm going to help you, and we're going to do a song, okay? Ready? I like to move it, move it. I like to move it, move it. I like to move it, move it. I like to move it. So we would just do something like that. So these are just really basic activities. So thank you, Drew, and thank you, Chelsea, for being an awesome participant.
So this music therapy can actually bring them out of that waxy state?
It can. They did a study that said that it will initiate movement in catatonic patients using rhythm instruments by placing the drumstick. Over time, they should initiate movement. So that's, again, not going to always work. They can have a catatonic state for hours up to days. Obviously, you're going to hope that they're on treatment and on medication. But like if you're in a hospital working with somebody and this is just really severe, you may come in there every day for an hour and work with them. And hopefully, eventually, it's like the central nervous system will sort of start activating the brain. Just that stimulation. This is kind of a different thing, but my brother has diabetes, and one time he went into a pre-coma state, and he lives in a very remote place in another country, and his wife just put some jelly on his lips, and then she started slapping his face, and she started lifting his legs, and she was in a place where there was not any medical care that could come right away. So basically, she was trying to force his brain to realize, you do not need to go to sleep right now, you need to wake up. And it took a good hour before he finally woke up, but it worked. So, in my opinion, it's kind of similar. It's like your brain's asleep, kind of, and you're just trying to tell it to wake up, and you're trying to get those muscles to react. So like I said, it may not always work right away, it may not be quick, but it's definitely been shown to have sometimes they'll stay in the catatonic state, but they'll start moving their arm by themselves, and you don't have to move it for them anymore. And at least that's getting somewhere. So that's just one instance of an activity that you can, or activities that you can do. The best thing I think about music therapy is that it can bring structure. and we talked about structure earlier. And music is very predictable, has rhythm, it's kind of mathematic, and it's just something that the brain, it actually has been shown in studies that the brain will light up, and it's like it can reorganize when it has that structure. So it's a very good teaching tool also. Sometimes we'll use lyric analysis and songwriting for mood. These are basically some things we've already talked about. Sometimes we'll do structured dance for movement disorders. We may even take a catatonic patient and just kind of try to dance with them, something like that. Or if they're not in a catatonic state, you can use dance as a way to do communication or socialization skills and things like that. Let's see how we're doing on time, because I don't want to keep y'all forever. Okay, so I'm just going to go ahead and go down to how can music therapy be incorporated into a psychiatric setting. Basically, how can you get a job in music therapy? And how can you work with patients who have schizophrenia? You do have to complete a music therapy program. At Sam Houston we have one. There are 4 other schools in Texas that have one. You can do it at the bachelor's level. You do not have to have a master's degree to practice as a music therapist, but there are master's programs available. You have to finish all of your coursework, and then before you can graduate, you have to do a 6-month internship at a facility anywhere in the U.S. based on a list that they're on the American Music Therapy website. And I'm actually starting my internship at an adult psychiatric hospital next spring, and I'm really excited. And it's at Florida State Hospital. They have a forensic unit and a civil unit. In Chattahoochee, yeah. So I actually may be working with some people with schizophrenia who are criminally insane or have been labeled as criminally insane. And also some people that are just civil, non-forensic. So I'm really excited about that. You have to do 6 months internship, and then you can come back and graduate. Then you have to sit for a board certification exam, and it's just a few hours long. And then you will be labeled MTBC, which stands for Music Therapist Board Certified. And at that point, you are eligible to practice as a music therapist. You can find careers in psychiatric hospitals and day treatment programs. You can get full-time opportunities there. You can do contract work. Just sign with somebody in that facility to work maybe a couple of days a week. Or you can have your own private practice. And as far as getting patients, you can get, if you're working in an established facility, sometimes you can get referrals from family, friends, hospital staffs, and sometimes even staff, and sometimes even patients themselves can request music therapy. Also, a lot of times physicians can prescribe music therapy, and if that's the case, sometimes it'll be covered by the patient's insurance. So the music therapist will come in, do an assessment, find out if the patient's a good candidate, like do they even like music, and find out what their treatment goals are, and then design a treatment plan for the patient. So in conclusion, music therapy has been shown to have significant effects for patients with schizophrenia. It helps manage positive, negative, and cognitive symptoms, helps with anxiety, depression, and emotional difficulties, and can improve social relationships and functions of daily living. So overall, it can contribute to a better quality of life. And that's my presentation. So thank you.